Hello everyone. Welcome to TCM Diagnostics featuring Tongue Diagnosis Made Easy, Part 16, presented by Lamp AccuWellness Foundation, Inc. Pale and swollen tongues. A pale tongue with a normal tongue shape and coating indicates only a slight deficiency of lung and spleen qi. In this case, the qi is not strong enough to transport the blood to the tongue, resulting in a paler coloration of the tongue body. The paleness of the tongue body is proportional to the degree of the deficiency. The paler the tongue body, the more serious the qi and yang deficiency. A pale and swollen tongue is very common. The tongue is pale because the yang qi is too weak to transport sufficient blood to the tongue. The tongue is also swollen as a result of qi and yang deficiency, which results in inadequate fluid transformation. Since the fluids are inadequately transformed, they accumulate and transform into dampness. The degree of swelling of the tongue body is inversely related to the strength of the yang and source qi. That is, a weak yang and source qi will result in a swollen tongue body. Physical overwork, excessive exercise, and overconsumption of raw foods and dairy products can cause deficiency of spleen qi and yang. If the pale tongue has a normal body shape, the deficiency is not as serious and can be rectified through a proper and regular diet as well as periods of rest. Pale and swollen tongues are often accompanied by teeth marks. The deeper and more distinctive the marks, the more serious the weakness of stomach and spleen qi, and spleen and kidney yang. Now let's take a look at some cases. We have here a 31-year-old female whose tongue is slightly pale, normal shape, red points at the tip, slightly white yellowish greasy coating at the posterior third. TCM diagnosis, slight spleen qi and blood deficiency, and slight food stagnation. Symptoms: fatigue, constipation, bouts of no appetite, epigastric fullness. Background to disease: overwork, irregular eating habits, excessive consumption of sweets. We have the second case of a 50-year-old male whose tongue is described as pale, swollen, slightly wet. TCM diagnosis: spleen qi deficiency with accumulation of dampness and blood deficiency. Symptoms: loud gurgling in abdomen, soft stools, excessive sputum, no appetite, panic attacks, difficulty in falling asleep, severe fatigue. Background to disease: excessive consumption of raw foods, excessive worrying, lack of sleep due to work's schedule, because the patient is on a night shift. Next, we have a 37-year-old male whose tongue is described as slightly pale, swollen, white, thin, slippery coating with yellow coating at the root. TCM diagnosis: spleen qi deficiency, accumulation of dampness, damp heat lodges in the lower burner. Patient complains of fatigue, especially after meals, lack of concentration, difficulty in falling asleep, loose, smelly stools. Background to disease: excessive consumption of dairy products, long fasting periods in the past. The normal body color should be pale red. The body color reflects the state of blood and nutritive qi and the yin organs. It reflects conditions of heat or cold and of yin or yang deficiency. A pale body color indicates either deficiency of yang or deficiency of blood. In deficiency of yang, the tongue is also usually slightly too wet, since deficient yang qi fails to transform and transport fluids. In deficiency of blood, the tongue tends to be somewhat dry. If the sides of the tongue are especially pale, or in severe cases, slightly orangey, it indicates deficiency of liver blood. The body shape of the tongue gives an indication of blood and nutritive qi, and it reflects full or empty character of a condition. A swollen tongue generally indicates retention of dampness or phlegm, especially phlegm. A partial swelling usually indicates heat. A swollen red tip indicates severe heart fire, while swollen and red sides indicate liver fire. Swollen sides that are wider, usually on a pale tongue, reflect spleen deficiency. A swelling in the front third of the tongue indicates phlegm in the lungs. Let's go to more cases. Next, we have a 35-year-old male whose tongue is described as pale and swollen, with yellow slippery coating at the posterior third. TCM diagnosis: spleen qi deficiency with accumulation of dampness and damp heat in the lower burner. Patient complains of frequent urination, turbid urine, lower back pain, constipation, stomach pains. Western diagnosis is chronic prostatitis. Background to disease: irregular eating habits. Next, we have a 41-year-old female whose tongue is described as pale, swollen, with red spots at the sides and tip, with white thin coating. TCM diagnosis: spleen qi deficiency with deficiency of blood and accumulation of dampness. Retained externally contracted heat. Patient complains of fatigue, weight gain, bloating, no periods for 3 months, cold extremities, frequent sore throats. Background: 6 pregnancies, overwork at the office and at home, and lack of sleep. Next, we have a 33-year-old female whose tongue is described as pale, swollen with teeth marks. TCM diagnosis: spleen yang deficiency with accumulation of dampness. Symptoms: watery stools in the morning without smell, frequent nausea, no drive, intense feeling of cold, migraines, diarrhea, vomiting preceding menstruation. Background: treated for a long time with tetracyclines for acne vulgaris, frequent illnesses in childhood. A swollen or puffy tongue generally means there is qi deficiency. Often there is a digestion issue or fatigue for a person with this sort of tongue. Also common with this type of tongue is the appearance of teeth marks on the sides. A swollen tongue can also mean that there is a retention of fluids. A pale tongue might indicate cold. If it's pale, swollen, and wet, there is probably a deficiency with a retention of dampness or phlegm. A person with this type of tongue would benefit from incorporating ginger and other warming foods in their diet. The size of the tongue body has to be related to the size of the head of the person. What might be swollen for someone may be normal for another. Because the thickness of the tongue body depends on the supply of fluids and blood, a swollen tongue body indicates an accumulation of fluids, which may be dampness, phlegm, or edema. Thus, swelling of the tongue always indicates a full condition, particularly characterized by dampness or phlegm. Although dampness and phlegm usually arise from a qi or yang deficiency, The swelling of the tongue body reflects the full condition created by these two pathogenic factors. Although a total swelling of the tongue always indicates dampness or phlegm, a partial swelling may indicate other pathologies such as qi deficiency, qi stagnation, or heat. The areas where a partial swelling is most commonly seen are the sides in the liver or chest area, the tip, and the front third. A swelling on the sides in the liver area is very common and usually indicates liver heat. It is nearly always associated with a red color in the same area. A swelling on the sides in the chest, breast area generally indicates either retention of phlegm in the chest or breast or lung qi deficiency. A swelling of the tip of the tongue, usually associated with a red color, is very common and indicates heart heat or heart fire, deriving from severe emotional problems. A swelling of the front third of the tongue indicates retention of phlegm in the lungs. Next, we have a 37-year-old female whose tongue is described as pale, swollen with teeth marks, red and slightly contracted tip, light yellow thin slippery coating. TCM diagnosis, spleen-yang deficiency with accumulation of dampness, heart blood deficiency with heat from deficiency in the heart, food stagnation, accumulation of turbid dampness. Symptoms: depression, no drive, no appetite, abdominal pain at time of ovulation, intense feeling of cold during menstruation. Western diagnosis: ovarian cysts. Background: excessive worry due to unemployment, overconsumption of sweet foods, emotional problems. Next, we have the tongue of a 25-year-old female, which is described as pale and swollen with light yellow greasy coating. TCM diagnosis: spleen qi deficiency with accumulation of dampness, food stagnation, accumulation of dampness in the middle burner, which transforms into heat. Patient complains of loose stools without smell 3 to 4 times daily, abdominal distension, flatulence, mood swings. Background: irregular eating habits, excessive consumption of dairy foods, unhappiness. Next, we have a 37-year-old female whose tongue is very pale, slightly bluish, and swollen. TCM diagnosis: spleen qi deficiency with blood deficiency and slight blood stasis, accumulation of dampness. Symptoms: tendency to catch colds, fatigue, sudden severe cramping pain in the abdomen. Background: overwork, lack of sleep. The term swollen refers to a tongue body with a body larger than normal. Although the tongue may be partially swollen in places, the term swollen indicates a tongue that is completely swollen in every part. Just as when the tongue is smaller than normal, it indicates that there is a lack of some substance, blood or urine. When it is larger than normal, it obviously indicates that there is a pathogenic factor, dampness or phlegm. One often hears that a swollen tongue indicates qi deficiency. This cannot be because the very swelling indicates the presence of an excess of a substance that should not be there, in this case, dampness or phlegm. Of course, it is true to say that dampness and phlegm themselves derive from qi deficiency, but the swelling itself indicates dampness or phlegm and not qi deficiency. When the tongue is completely swollen, it indicates the presence of dampness or phlegm, but especially phlegm. Dampness is indicated more by the stickiness of the coating. Note how the tongue changes shape when it is swollen. It becomes more round. A partial swelling of the tongue indicates either the location of phlegm in a particular part of the body or, in some cases, heat, in which case that particular area would also be red. Next example is a 67-year-old female whose tongue is described as pale, very swollen, with teeth marks. TCM diagnosis: kidney yang, spleen yang, heart yang deficiency. Western diagnosis is chronic gastritis. Symptoms: extreme physical weakness, cold feeling, cold extremities, sensation of cold in the stomach, stomach pain. Background: chronic physical overwork. The last case is that of a 27-year-old female whose tongue is pale, very swollen, and wide, with small vertical cracks in the center, white thin coating. TCM diagnosis: spleen qi and yang deficiency, with accumulation of dampness, and stomach qi deficiency. Symptoms: exhaustion, feeling of pressure in the center of the stomach with stress, weight gain, pain, tingling and numbness in the right arm and hand. Background: overwork, irregular eating habits, excessive consumption of raw foods, and cold fruit juices. Now let's look at the case history of the patient. Mrs. W had spent 2 years in South Africa, where she followed a diet that consisted mainly of fruits and juices. Because she felt really well on this diet regime, she maintained the diet when she returned to Germany. She started a new job as manager of a big company, but after 6 months on the job, she experienced exhaustion, fatigue, and steady weight gain. She also developed an occasional pain and persistent numbness in her right arm. The pale tongue was extremely swollen. Her pulses were soggy and frail. Spleen yang deficiency, as manifested in pale and swollen tongue body, was caused by inappropriate diet for the cold, damp climate of northern Germany, as well as requirements of a new job that took all of her strength. Because of the accumulation of dampness associated with weak yang, she constantly gained weight. Her exhaustion and soggy, frail pulse confirmed the diagnosis of spleen yang deficiency. The numbness in her arm was the result of dampness obstructing the channels and collaterals. All Western-style diagnostic procedures failed to diagnose any disorder with this patient. Pale, swollen tongues are unmistakable signs of spleen qi and yang or kidney yang deficiency. Foods of a cool or cold nature specifically damage spleen qi and yang, especially when consumed in cold climates. From this deficiency, a condition of excess, the accumulation of dampness, can arise. This accumulation blocks the flow of qi and blood and can cause a sensation of heaviness in the body, that is, numbness. Patients with such tongues should be given dietary advice. Thank you very much for your attention. See you in our next videos.